Hi everybody, thanks for coming. So this is our first in-person meeting of the Healthcare Transformation Committee, and it's a great turnout, so thank you all for being here. And also thanks for all the guests. We have a lot of special guests here this evening. This is something, we just started this committee last year as part of the chapter. I'm really thinking about how do we do pediatric healthcare transformation. And so it's amazing to actually just 9 months later have this meeting today where we have our partners from the Healthcare Authority and the Department of Health and Molina. We have a guest speaker who's an expert on healthcare transformation, all coming together, and so many chapter members and committee members. So thank you all for being here today. We're going to do the meeting in 3 parts, but there will be no intermission. So find your way to the restroom at any point you need to, and don't hesitate to get up and get some food and get some water or whatever you need, okay? I think the other great thing about having an in-person meeting versus the phone meetings we've been having is personal engagement. So you're all going to be asked to participate in some way, and when I remember, I'm going to pass out a bunch of index cards for you guys so that you can ask questions, particularly as you think about the project that we're doing and the discussion that we have from Drew. Sarah's going to help me. They're in the bag there. Write down your questions so that we can ask our panelists questions in sort of in an easy way at the end of the meeting. The second thing I want you all to do is think about how you can commit to this work. This is work that's going to take a lot of people and a lot of partnership between a lot of different agencies and a lot of practices. So think about, as you're listening, to how can you be involved in the work that we're doing. All right, do you want to go to the next slide, Jennifer? Oh, can you do the next one?
Yeah.
Okay, so Sarah reminded me last week about a book called Start With Why. Have any of you guys read that book? It's a book by Simon Sinek, and he really talks about the importance of starting with why in anything you do. And if you can focus and really firmly root yourself in the purpose of what you're doing, then you can really focus in earnest and effectively on the what and the how of what you're trying to accomplish. So that's what we're going to walk through now is the why, the how, and the what. Go ahead to the next one. So starting with the why or the purpose. So why are we focused on pediatric healthcare transformation? Because certainly we've learned over the past couple of decades that there are many serious and potentially fatal flaws with our healthcare system. We know that the cost is continuously growing and it's unsustainable. Oh, can you go to the next slide? That's this one. And then the next one after that. And we also know that we have a huge amounts of variation in quality and a lot of health inequity. I'm not going to talk too much more about that because I know Drew's going to talk a little bit about that during his presentation. Go ahead, next one. So why is this important for us to be focused on now? So, next one. The kids in our state, they really need and they deserve better care. Our providers are burning out and trying to deliver more care faster with less resources. And for many people, they're saying it's not worth it anymore. It's too hard to do. Consumers and payers can no longer afford the care that we're providing. And then one more. And then on the hopeful side, right now we're in the midst of healthcare transformation in our state, and this is the perfect time to be thinking about how are we transforming care for kids. So recognizing that this is happening and that kids, that the healthcare that kids need is a great risk for not being addressed because they don't cost a whole lot and they're not always at the front of our minds when we think about healthcare transformation. The chapter started the Transformation Committee last year, and really the purpose is to support the system and practice changes needed to achieve healthcare transformation across the state. And we talked about this last year to do it by really engaging with state and regional efforts that are happening, ensuring that the pediatric population is being addressed effectively, working with practices to educate and share and spread improved care delivery practices, and then working closely with our legislative advocacy partners to be sure that we're affecting the appropriate policy changes that are needed. So, I'm sorry Matt's not here. Is Matt here? So Matt is one of our pediatricians from Spokane, and he's on our committee. And he always said, oh, there's Matt. Hi, Matt.
Wow.
You came in at exactly the right time.
You guys planned that.
So what's the question that you always ask, Matt? What is transformation? Do you ask that every time? And you ask?
Well, yeah, I guess so.
You do. So I wanted to just spend a minute and think about, for Matt's sake and for all of our sake, what is transformation? So the definition from Oxford Dictionary is a thorough and dramatic change in form or appearance. So when you think, okay, Jennifer, you're going too fast.
Sorry.
If you Google transformation, what's the most common image that appears? The butterfly, right? And the butterfly is a beautiful example because it really is it's a dramatic representation of transformation, right? It's this like little icky bug that crawls around and eats that you don't want to touch. And then in a short period of time, it goes into a larva and becomes this other beautiful, bug nevertheless. But that flies and can do all kinds of things, right? So that's the most common one, but what was the one that probably would appeal most to Matt? This is Bruce Banner turning into the Incredible Hulk, right? Another beautiful example of transformation. So now I'm sure, thinking about that, Matt knows exactly what transformation is, right?
Angry and
That's right.
Yeah.
So what is healthcare transformation? And I think that we've been doing a lot of thinking about it, and the IHI has been a leader in thinking about what healthcare transformation is, and most people think of it as the triple aim, or more recently, the quadruple aim. So I think that we can probably mostly agree on that. It's better care, better health, reducing costs, and really improving, provider, clinician work life, so that not everyone who's in the system is getting burned out the way they are today. So the real question is, so we know why we're doing this and we know what, but really what's the how, right? So how does transformation happen? And I think that that's often the most challenging thing. So who here has had a transformational experience? Anybody had transformational experience? Wait, Matt has had one. You've had one.
Confession.
Can you say quickly what it is?
We have a pediatric social worker, counselor, and a pediatric psychiatrist in the clinic, and it has been revolutionary.
Totally changed the way you practice? Yeah. So, that's a great example, and I think a lot of people are doing that. So I had a really interesting transformational experience this past year that I think a lot of people have heard me talk about. You can click the next slide. It's called Burning Man. Anybody been to Burning Man? Do you guys know what Burning Man is? Yeah, so Burning Man is amazing. It's a city that's created in the desert in Nevada that is the third largest city in Nevada during that 1 week that it exists, right? And it's amazing in and of itself that you can create and then destroy or take down or burn a city in 1 week. But what's even more amazing is the transformation that happens in the people that attend Burning Man, right? And so how can 70,000 people come to a city that don't know each other and really be changed when they leave? They change during that time. You change the way you think about yourself, you change the way you think about and relate to other people, and you really become a different person just from that 1 week. And what's incredible is that it's a lasting change. You don't change back. It's not like a vacation that you go on and then you come back and you're, okay, I'm back to the grind again. But it actually took me 6 months to kind of come down from Burning Man. And now people ask me, I'm about a 2 out of 10. But I was 9 or 8 for a long time, right? And the question is, how does that happen? And the way that it happens is Burning Man has looked at this experience and said, what is happening here? And they've defined what people are, what's happening to them under 10 principles. And if everybody that goes really lives and bees those 10 principles, then then you will have the same transformational experience, right? And so it's really about being the things that are on that list there. And 5 of them really, I think, have a lot of parallels to the work that we're trying to do in healthcare transformation. The first one is radical inclusion. So everybody is welcome, right? So there's no one that's excluded. The second one is participation. So no sitting on the sidelines and seeing what's going to happen. Everybody has to participate. The third one is radical self-reliance, so that people discover, exercise, and rely on their inner resources. And I think that that's certainly key for healthcare transformation, because I think a lot of us are waiting for someone to provide the solution to us, but most of it's going to come from what we do for ourselves, working with other people. The fourth one is communal effort, so all of us working together. And the fifth one is civic responsibility. There's 5 others, but I think those are the 5 that really apply to the type of transformation that we're talking about. So next slide. So how does pediatric healthcare transformation happen? So we're going to hear in a little bit what has happened at Rainbow Babies and Children's Hospital and the work that Drew has done. But first, we just want to talk about how we're trying to help, transform healthcare in Washington State through the Pediatric TCPI grant. I think. Go ahead on to the next slide. So the Pediatric TCPI grant, so the Transforming Clinical Practices Initiative, starts with the CMS grant, right? And the goal of the grant is to transform 140,000 clinician practices. The goal over the 4 years is to improve the health care of millions of Medicare, Medicaid, and CHIP beneficiaries, to reduce waste in the system by reducing unnecessary hospitalization, unnecessary testing and procedures, to generate $1 to $4 billion in savings, and then to transition 75% of practices completing the program to alternative payment methods. And it's really, the other goal is to build the evidence base on practice transformation so that the effective solutions that we learn can be further scaled. And so some of us, Phyllis, myself, and others, attended a model practice conference from CMS in Baltimore a couple of months ago. And what's cool is that many practices are doing this, right? And they were able to come and share their stories. So the grant is really designed to learn from model practices such as Phyllis's, and how do you package that, and how do you begin to do that in all practices? So there's 5 phases of transformation. First, it's setting aims. The second is to use data to drive care. The third is to achieve progress on those aims. The fourth is to achieve benchmark status. And the fifth is to then thrive within pay-for-value approaches. And and it seems simple, like we talked about transformation being major change as opposed to incremental change, right? And I think many of us over the past 10 or 15 years have done incremental changes within our practice. The idea here is to take many, many incremental changes with everybody doing them at the same time, aligned together with the payers, and change the system together with what they're trying to do in order to transform the whole system. Go ahead, on to the next one. The focus of the practice aims are aligned through drivers that they call a change package. And the primary drivers you see here are person and family-centered care design, continuous data-driven quality improvement, and sustainable business practices. And from there's a whole series of secondary and tertiary drivers that then finally lead to change concepts that the practices can look through and decide, okay, what are the things that my practice and my community and my region needs to improve health, and how do I begin to work on those through supported, facilitated change? Go ahead. We're lucky, so the whole TCPI grant has 29 practice transformation networks, which is what we are. And 4 of those are in Washington State. There's ours, there's one at the University of Washington, Peace Health, and then the National Rural Accountable Care Consortium. We're also fortunate in that we're one of only 2 pediatric TCP or practice transformation networks in the country. There's us, and then there's one down in Los Angeles that I can never remember the name of. So Next slide. So here's a little bit, what is Pediatric TCPI? So it's a partnership between the Department of Health, the chapter, and Molina Healthcare. And really it's about how do we reach and transform 5,600 clinicians in Washington State, both doing pediatric medical care as well as behavioral health care. And through that, improve the cost and quality for 350,000 children 0 to 20 in our state. So I'm going to have Sarah come up and tell you a little bit more of the specifics about the TCPI grant.
So thank you, Mike, for that great overview. I'm not going to have any incredible hopes, and my life is clearly not interesting enough because I haven't been to Burning Man. But I do want to give you some of the information about what we're doing in the Pediatric Transformation Project in our state. We'll share with you 6 teams, and that'll help give some life to the work that we're doing. The first team I'll share with you is the engagement team, which is led by Dr. Beth Harvey. Beth, raise your hand. Beth is a general pediatrician in Olympia and is the former chapter president for the Washington chapter of the AAP. And we're working with pediatricians and family physicians. Sorry, it's mine. I can't even be annoyed. I'd be annoyed with myself. Working with pediatricians, family physicians, advanced practice providers around the state to get them engaged in our initiative and to expand our reach and depth. We have physician champions from all the regions around our state, as well as behavioral health champions that will be recruited from the regions around our state, who can serve as the voice. They're early adopters who are excited about transformation, will help share their stories and passion for healthcare transformation. The next team I'll share with you is the primary care team, led by Dr. Phyllis Cavens. Phyllis, raise your hand. The Child and Adolescent Clinic in Longview, as Mike mentioned, is really a model clinic, and they have tackled so many of the problems that we need to tackle to improve quality and reduce cost for kids in Washington State. And they've done so in one of the poorest communities in our state, and I think it's over 70% of your patients are on Medicaid. Is that right, Dr. Cavens? So what the Child and Adolescent Clinic is doing for this initiative is they're taking content and translating that into information that practices can use to make a difference for their kids. The Child and Adolescent Clinic has figured out how to tap into health home funding for care coordination for children who have special needs. And they're using their data to improve population health, and they can help teach clinics how to do that. And they also have done a masterful job at decreasing avoidable emergency department utilization. And as our engagement team travels around the state and talks to providers, there are many people who want to learn how to do that. So we're really delighted to have the primary care team translating their best practice into static content that people can plug into as they need to. So one of the things that we'll be doing through this initiative is giving people access to written materials, recorded webinars, to reflect how busy folks are and to allow them to tap into this in a time and way that isn't going to interfere with their ability to be with their patients or team. Next team. The behavioral health team is our next team in the initiative. This is led by Dr. Robert Hilt, Bob Hilt from Seattle Children's Hospital, who I'm sure many of you in the room know his incredible work to try and improve access to timely behavioral health care for children in our state. On our team, we have terrific support from the leaders of behavioral health from Molina, as well as the Washington Behavioral Health Council, which represents community mental health centers around our state, the Washington State Medical Association, and 2 pediatricians, community pediatricians who are members of our chapter, Francie Chalmers and Peter, help me with Peter's last name, Francie, at a loss. Oh, I hope he doesn't watch the video. So, Peter Holden from Wenatchee. is a very passionate community pediatrician about improving kids' access to behavioral health care. So what the team is doing is supporting primary care providers around the state through peer-led training model to improve skills, tools, and confidence in managing mild to moderate behavioral health needs within their own scope of practice. So you all know that kids are appearing in primary care offices with behavioral health needs, and that's where they're getting their services. So we want to help improve primary care providers' ability to meet those needs when they present and where they are. We'll also be working to break down some of the barriers to referrals out to specialists. We know that access is a big problem, and we will be working closely with Molina and the Washington Behavioral Health Council to make referrals more transparent, communication and coordination better across what are currently silos between primary care and specialty behavioral health. Break down some of those silos. The next team is the data strategy team, and through our great partnership with Molina, we are providing regular data to clinics in their performance in our clinical focus areas. And the data strategy team is interpreting the data and using this data to inform care on an ongoing basis. The next team is the medical neighborhood team. And this team will strengthen clinical and community partnerships for comprehensive pediatric care, including multi-specialty care, social services, and state and local public health services. We're excited that Children's Village, Jackie McPhee at Children's Village will be leading the medical neighborhood team. And I think that's going to be a great fit for us. And finally, the healthcare transformation team, that's who's hosting you tonight. There are many of us in the room. We want to, as we work hard on transformation and providers work hard on transformation all over the state, we want to make sure we have a place where all of our learnings can bubble to the top and reinforce our partnership with the healthcare authority and managed care plans to improve the quality of care for kids in our state. So the healthcare transformation team's role is to communicate and coordinate healthcare transformation priorities for kids at the state level and to promote pediatric providers having direct engagement in this process. Our team has been very active since we formed in July in partnering with Marianne and the Healthcare Authority on the Medicaid waiver and submitting project ideas that we think will make a difference for kids' health under the waiver. We are delighted that the Healthcare Authority is pulling together a work group on pediatric healthcare measures for the common measure set for cost and quality. These are some of the things that the healthcare transformation team is really contributing to. And we see that this initiative is a way for us to hear from the front lines, what do we need to do systemically to improve the quality of our Medicaid program for children in the states. We're very excited to have that opportunity. Next slide, please. So the clinical goals for our program are to improve immunization rates, increase well child rates, improve asthma outcomes, improve behavioral health, decrease avoidable ED visits and hospitalizations, and improve coordination of care. These goals, as I mentioned, will be measured by the data strategy team under Molina's leadership. Next slide, please. So here's some of the ways that we're supporting teams at the clinic and system level. We're engaging clinics and systems to make improvements in the areas that they most value for pediatric health. So if you think about the last slide as a menu of options, what do you really want to improve for the children that you serve? Practices that engage in this project can pick a focal area or focus areas in which they want to improve. And then we're building a community of pediatric providers to help connect practices to one another to improve in those different domains. And are also bringing some of the best resources available from known leaders in our state, like the Child and Adolescent Clinic, and from the national organizations like AAP, to move the needle on things like immunization rates and reducing ED utilization. We're increasing capacity of PCPs to support behavioral health needs, as I mentioned to you. And one of the things that's so exciting about this project is getting alignment in the measures for quality that folks can be incented to achieve in their contractual relationships with Molina. So as Melina is renewing contracts with providers, the measures that people can use for value-based payment are matching up with the measures that pediatricians from the chapter have said matter for kids. So we're delighted to have this opportunity to sit at the table together and do this hard work. Next slide, please. So the reason you're all here on a 75-degree sunny night in Seattle, Dr. Hertz, we don't have those as often as we might like. You're here because you want to improve child health. And that's why the chapter exists, to improve child health. And I want to step back or higher up and say, how does this project allow us to do that? And it is these strategic partnerships between the Department of Health, the Healthcare Authority, Molina, the providers all over the state who are working so hard every day. It's through these relationships and partnerships that I think we're going to really improve child health. One of the words that we use a lot in describing this initiative is it is a collaborative, and it is through collaborative even at the local level that will improve child health. So as people are feeling, as providers and MAs and nurses are feeling tired and overwhelmed in their day-to-day work, we're hoping that the peer relationships and collaborative relationships across clinics are going to help people pull away from that burnout and learn strategies that are working in neighbor clinics down the road. And we want to support culture change across all the clinics that we're engaging in this process, to have a culture of continuous improvement. And many clinics do this and have this, and many would love to but don't know how. So this is a great opportunity for us to support people in doing the work that matters to them and making marked and measurable improvements in child health. And as Mike mentioned, our collective impact on child health. So given that we have 5 major clinical areas that we're focused on, there will be a critical mass that forms as clinics choose common measures to improve upon. We're going to learn from each other and make a difference as a collective by the incremental changes that are happening one clinic at a time. So how are we going to do this? DOH, under Diana Bridges-Finn's leadership, where are you, Diana? DOH has practice facilitators who are in the different 9 regions of our state, who will partner with clinics on an assessment that CMS has established, a practice assessment tool. And this assessment helps a practice identify where they are in the continuum of transformation. So some practices are in the cocoon, right? They know they want to make a difference for their patients, and they don't know how to do that yet. They're not resourced to use their EHR, they don't have an analyst to get the data they need, and they want to. And then there are practices that are already a butterfly. And our practice facilitators do this assessment with you, and they find through the process, practices are identifying what their gaps are and what their passions are to focus their efforts in the initiative. Then the practice facilitators are also going to be the real knowledge base of what are community resources. As you all know, mapping community resources is a big undertaking and no one has time to do it. And the practice facilitators are going to take that burden off of providers and off of nurses so that it's more transparent how to tap into the resources that patients need. Next slide, please. So in each region, there will be a regional transformation team that includes the practice facilitator, the provider champion, and the behavioral health champion. And the champions at the local level are role models and early adopters who are spreading transformation through their examples and stories. And as clinics get engaged and find roadblocks, they will have providers who are peers that they can reach out to and get consultation on how to improve the work that they're doing. Next slide, please. So I hope this map is familiar to everybody in the room except Dr. Hertz.
I've seen it online.
He did his homework. We have 9 accountable communities of health in our state, and this map represents the 9 regions. And those teams that I just described are going to be in each region. I want to acknowledge that we have 2 provider champions in the room, Thatcher Feltz And Thatcher is going to be covering a lot of territory, he recently pointed out to me. He works in the Greater Columbia region in Grandview and is going to help us with Tri-Cities as well as the Yakima region in engaging providers in the project. And then we have Francie Chalmers, back of the room, and Francie works in Skagit in the North Sound region. We've also have some other physician champions who are not here. Christy Rice in the Spokane area and the Better Health Together region. Niran Al-Agba, who is in Silverdale in Kitsap in the Olympic region. And Jennifer Polly, who is in Chehalis in the Cascade Pacific Action Alliance. So these are some of our early adopters we're so excited to have working with us. So from our transformation teams and champions, we're aligning with these regions to contribute to Healthier Washington. And I will turn it over to Kathleen Clark, who will help us with understanding Healthier Washington and how Pediatric Transforming Clinical Practice Initiative is such an important part of Healthier Washington. Thank you, Kathleen.
Well, good afternoon. I'm actually functioning as the director for the Pediatric TCPI, and I am very pleased to be working with such a dedicated and committed group of pediatricians and the Molina Healthcare folks. I am here to show you how well aligned and actually how much we are contributing to the implementation of Healthier Washington. And I wanted to start with, in case you didn't know, what Healthier Washington is, and I think the 3 bullet points are really where I can show our alignment. But it's an initiative to help people experience better health throughout their lives and receive better and more affordable care. This is a unique multi-agency effort on behalf of the Department of Social and Health Services, the Healthcare Authority, and the Department of Health, and supported by federal funding. We are working with public and private sector, just like all of you, to build healthier communities through a collaborative regional approach and to integrate physical and behavioral health so that we can focus on the whole person and improve how we pay for services by rewarding quality versus quantity. And so I'll draw a few analogies, and I think you've already heard from Mike and Sarah how much this initiative is aligned and actively participating in the implementation of Healthier Washington. So the next slide is, first of all, there is an investment of Healthier Washington called the Practice Transformation Support Hub, which is tasked with assisting providers in improving community clinical linkages, the integration of behavioral health with primary care, and payment reform. And so you can see that we're doing much the same thing side by side in the pediatric initiative. I wanted to point out that Dr. Dan Lessler, who will be up in the panel, is the co-lead of the Practice Transformation Hub. But one of the interesting things is that both the Hub and TCPI are led by the Department of Health. So we work very, very closely together. And we are taking a regional approach. You heard Sarah talk about the triad team for pediatrics, and soon, probably by fall, the hub will have regional health connectors in each of the regions. So they'll be working beyond pediatrics, of course, but the intent will be that those connectors will be working very closely with our team to, again, look at the gaps in the region where they need to shore up some community clinical linkages, or where there needs to be training and technical assistance across all of the practices. We're definitely addressing behavioral access, health access, and integration for kids. So I think we'll be able to feed some information that we learned to the larger effort of Healthier Washington in the behavioral health integration piece. We have aligned our clinical improvement measures with the common measure set And our state has taken a stand to have a common set of measures that we're all working from, which is wonderful for quality improvement. Week 6 of our measures are currently in the common measure set. And one other thing that just happened in the last week or so is that the performance work group, who is a steward of these measures, made a decision to focus on pediatric measures for the upcoming year. So 2 of our team members, Dr. Howard Jeffries and Dr. Angela Riley, who's also in the room from Alena, are on that committee. They'll be reviewing the pediatric measures on the common measure set and determining if they need to be revised or revisited or added or dropped. And then we will definitely be focusing on preparing our pediatric and primary care who see kids for a value-based payment model, and we'll be able to work hand in hand with the Hub Transformation Support Team who's going to be doing the same thing. So we are marching together in lockstep, and I kind of think it's like a huge wave is coming to shore, and we really are going to be able to make a difference with all of us so well aligned. Thank you.